Imagine a 5-month recovery time knocked down to 24 hours. It's possible thanks to advances in minimally invasive surgery.
Tonight, in a special Health 9 report, Graham Elkins takes you inside the OR for a look at a procedure only performed twice so far in Baton Rouge.
All right, Mr. Norton, so how we doing?
Well, doing wonderful.
Ron Norton is finally feeling like himself again. A routine physical earlier this year uncovered a ticking time bomb. A longtime smoker, Norton's doctor ordered a low-dose CAT scan of the lungs.
He called me back and said, good news, you don't have lung cancer. But the bad news is you got an aneurysm that's about 5 centimeters.
An abdominal aortic aneurysm is a dangerous swelling of the aorta, the body's main artery. If left untreated, the prognosis is not good.
At some point, it's going to burst, and then, you're not going to survive it.
Norton was referred here to the Vascular Specialty Center inside Baton Rouge General. Traditional treatment to repair a large aneurysm means opening up the stomach and removing the damaged aorta. Recovery time is substantial and the potential complications dangerous.
Doctors decided Mr. Norton was the perfect candidate for an aortic repair without any incisions. It's a complicated procedure only performed once before at this hospital, and we were invited to watch.
A team of surgeons is in place, including Dr. Vince Weaver. They will insert this custom-made stent graft inside Norton's aorta to reinforce it.
What we do is we have 3D reconstructions, and we could see where all of the kidney arteries, the arteries that are going to the bowel, and then we custom design on the graft at certain clock positions to fit that one patient's anatomy.
To get that inside the patient, it's collapsed and fed through a large needle into the main thigh artery at the groin. The needle punctures in each thigh are the only openings made during surgery.
Actually just mag up and wait a little bit.
Then, using precise imaging and careful movements of the wrist, surgeons watch as they snake the stent graft into the aorta on a guide wire. Once in place, it's opened up to its full size. The bulge seen here is the aneurysm. The goal of the surgery is not to shrink it, but stop it from getting any bigger. Doctors eventually add more guide wires to connect the stent graft to the kidney arteries. Dye is injected to make sure it's in the right place, a crucial step to keep blood flowing to those vital organs. Some 4 hours later, all the wires are removed, and Norton is left with just 2 tiny holes. What could have been a recovery measured in months is now measured in hours.
If he had open surgery, tomorrow he could be on a ventilator, or he won't be eating for at least 3 days, and this patient will probably be walking out of the hospital tomorrow.
Now you can get back to your normal activities. You can cut the grass. I know you may not want to tell her that.
1 month after the surgery, Norton has no complaints.
Very fortunate, and I'm very grateful and very thankful for the team of doctors that I had. I call it a miracle of modern medicine.
Norton has since become an advocate for prevention. Medicare recently approved a screening ultrasound for some patients. Risk factors include men over age 60 with a history of tobacco use, a history of heart disease, or a family history of abdominal aortic aneurysms.
It's a silent killer. You don't know you have it. I had no clue that I had it.
Ask your doctor if you think you could be at risk. Graham Elkins, WAFB 9 Healthline.